The numbers are grim, and the trajectory is worse. According to a new study published in JAMA Network Open, the United States saw a staggering 28% rise in pregnancy-related deaths between 2018 and 2022. Over 6,000 women, 6,283 to be exact, died from causes linked to pregnancy during this period. And despite a slight dip in 2022, the rate remains alarmingly high. Nearly 1 in every 3,000 pregnancies ends in the mother's death. This is not a fluke or a statistical hiccup. This is a public health disaster, unfolding quietly within one of the richest nations on Earth. The data paints a deeply troubling picture, from 25.3 deaths per 100,000 live births in 2018 to a peak of 44.1 in 2021. Even with a modest decline to 32.6 in 2022, the U.S. maternal death rate remains the highest among all high-income countries. That's not a matter of medical limitations. It's a matter of national priorities. And based on these numbers, it's clear that the health and survival of pregnant women in the U.S. simply aren't one. While the study does not investigate every root cause of this sharp increase, it does hint at one undeniable stressor: the COVID-19 pandemic, which wreaked havoc on already overstretched health systems in 2021. But blaming COVID-19 alone is a convenient excuse that hides the deeper, older rot in the American healthcare structure. The variation between states is too wide, too systemic, to be chalked up to one virus. Alabama, with 59.7 maternal deaths per 100,000 births, is a grim outlier, but Mississippi follows closely, and several others are not far behind. In contrast, California, at 18.5, is proof that this crisis can be mitigated. The fact that over 2,600 deaths could have been avoided if all states performed like California should be setting off alarm bells, not just in hospitals, but in legislatures. Instead, we see neglect, apathy, in some cases, even hostility toward reproductive and maternal health. And the disparities are even more horrifying when you look through the lens of race and ethnicity. American Indian and Alaska Native women face maternal death rates nearly 4 times higher than white women. Black women, already long burdened by institutional racism in healthcare, are nearly 3 times more likely to die due to pregnancy-related causes. These are not just numbers. They are the outcomes of systemic inequality, unspoken biases in treatment, and the brutal legacy of a system that has never treated all women equally. What's more, a significant portion of these deaths, almost 1,900, were classified as late maternal deaths, occurring weeks or even months after birth. These are especially disturbing because they often fall into a chasm in the healthcare system, a dangerous no-man's land between the end of obstetric care and the assumption that primary care will pick up the slack. But it often doesn't. For too many women, especially in marginalized communities, there is no safety net once the baby is born. The system simply walks away. We're also seeing a rising toll from causes that should set off national soul-searching: cardiovascular disease, cancers, mental health disorders, and substance-related deaths. These aren't just medical challenges. They're reflections of neglect, of women not being listened to, not being followed up with, and not being given the basic human right to survive childbirth and its aftermath. This isn't just a failure of medicine. It's a failure of policy, of investment, and of national will. Access to prenatal care, safe delivery, and thorough postpartum support shouldn't depend on your zip code, your insurance status, or the color of your skin. Yet here we are, with some states still gutting Medicaid expansion, closing down maternal care units in rural areas, and pushing policies that make it harder, not easier, for women to access comprehensive reproductive health care. And let's not forget the chilling political backdrop: rising abortion bans, declining OB/GYN availability in key regions, and a cultural war being waged over women's bodies while actual women die. As more states tighten restrictions and gut reproductive services under the guise of life, the maternal death toll is going up. The irony would be laughable if it weren't so deadly. This crisis should be at the top of every political platform, in every newsroom, and on the minds of every policymaker in America. Yet it's often buried under economic headlines, campaign noise, and social media fluff. And the people dying, disproportionately poor, rural, and women of color, remain invisible. We are failing mothers. We are failing families. And unless this country makes a radical turn toward investing in maternal health, equitable access to care, and meaningful reform, the death toll will continue to rise. Because no matter how advanced our technology or how high our GDP, none of it matters if women can't survive pregnancy.